It's important for all clinical teams to meet. Without meetings, it's very difficult to function as a team, to understand the opportunities that having multiple people all committed to quality improvement provides. This video includes two quite different clinical organizations. The first is the Ocean Park Health Center, which is a complex ambulatory care facility in San Francisco. The second is Eureka Internal Medicine, one pod of a medium-sized multi-specialty internal medicine group. The Ocean Park team is made up of representatives from key sectors of the organization that's specifically addressing the quality of diabetes care. So doctors, nurses, medical assistants, lab technicians, pharmacists, and so on.
We have different teams that meet at different times, each engaged in a different quality improvement project. And we feel that it's important for everyone to be part of some team because it helps them to focus on ways to improve care.
It's always better to get it from the staff, who is really mostly involved in carrying out a lot of these projects. They probably know best how an idea will work or not work before we even begin the process.
Team meetings are important because they allow us to communicate any issues that have come up. They're also a way for us to coordinate care as well as to standardize processes throughout the clinic.
It really helped to decrease the confusion. Without this team meeting, we won't hear the same message.
The Eureka Internal Medicine team is the entire staff. Its agenda is broader, but clinical quality is the primary reason for that team meeting.
With these pod meetings, we're all coming together. The receptionist, the nurse, the doctor, the clerks, everybody needs to be involved.
We need to get the people who are doing the jobs to step up and look at their processes and say, you know, we don't need to continue the way we've doing things just because historically it's the way it's always been done.
We hear exactly what is expected of us. If we have a problem with it, we can voice our opinions. We work on intertwining together so everything goes smoothly. Everybody's job is defined.
Everything from, how can we improve people's diabetes care to who's going to take care of the toilet that keeps running was dealt with at these meetings.
What makes meetings effective are a clear agenda, a clear start and stop time, opportunities for everybody to participate, and finally, an agenda that matters to the people sitting around the table.
Our office does it every 2 weeks. We call it the Annex Pod meeting. Basically, it's mandatory.
We pay our staff members to attend the meeting. We keep minutes of our meetings. We have a written agenda. The staff members are the ones who keep the minutes, and they've been rotating the task of that so that no one person has to do it all the time. If an item isn't solved at a given meeting, it stays on as old business, and we bring it back, and we keep on dealing with issues until hopefully we're able to resolve them.
It's usually on a Tuesday morning for about half an hour, and so it's very focused, it's very specific. We have agenda items that we go over. There's minute taking, and it's on a rotational basis among all the team members. It just really helps us to hone in on what are the key items that we want to discuss.
We also have action items that staff members will take on that they're responsible for looking up or acting on during the week. And the minutes actually serve as a tickler for following up on those action items.
They give us a half hour every week, free of clinical duties. If you didn't have that time set aside, it doesn't really work. So I think their commitment to this by allowing that time really makes it possible.
These are conversations among the different members of clinical teams, sharing their disciplinary point of view, trying to figure out how collectively they can work better to meet the needs of patients.
There's so much you can learn from the people you work with about how to make things work better.
I have my own jobs and things that I have to do, and I don't necessarily understand every aspect of their job.
So the meetings have helped me to understand what they do in their day and also how that can flow over to me.
For instance, the person working in the chart room to suddenly realize like they were part of a team taking care of patients made their job that much more meaningful. They can walk up to the scheduler and say, this person hasn't had their mammogram for over a year, and the person get a mammogram. You don't really need a physician to do that.
I represent the medical assistant, so I can give feedback from the clinic what is work, what is not, a good result.
And then you go out, you go back to clinic, and you try to put it into practice. And certainly, we try something, it doesn't always work. We go back and we revise and try again. You're really working together and supporting each other. It's a real team. It's not sort of a team on paper.
There is always room for improvement. There is no practice that is perfect, and the best quality improvement is continuous.
When we first started out, we actually had a diabetes foot screening rate of 10%. As a result of these team meetings, we were able to come up with a training, a proctoring, a process for actually doing these screenings in clinic. And over time, we were able to increase our screening rates to 85%.
What we found was that a lot of things about the day-to-day running of our office came to light that we had no idea about before the meetings.
Because they call their pharmacy and they sit in, refill or whatever.
I go on the delegated list, nope, it's not there. I look off the fax, nope, it's not there.
I found out that sometimes they'd spend 2 hours filling one prescription. It just didn't seem like a very good use of time, and everyone agreed with that because they were really frustrated by the processes, and it gave them a safe place to talk about it.
Yeah, I think it's very important that people see that we are improving things, that we are making positive steps. I think that's how you get buy-in from your staff.
It's relatively easy to recognize an effective team meeting by the extent of participation, especially by those lower down the salary scale and the hierarchy.
And everybody knows they can say anything in our meeting. The doctors don't take offense, the employees don't take offense, and then we try to work to solve the problem.
It's one thing to have the boss tell you, this is a problem, this is what we're going to do about it. But when you're sitting amongst your coworkers, talking about these problems, generating ideas how to improve things, people really take ownership of that. And so you'll have the health worker wants to improve the Pneumovax rate, so they're talking to the patients about it. It's not just the provider having to do that. We're providing a more consistent message to the patients.
At first, we weren't too sure of the pod meetings. We thought, I have to give up my lunch hour. But it's been very beneficial. Mainly it's focusing on the patients, and that's the number one priority. We're here to serve the patients. So if we can have a pod meeting, I'll give up 2 lunch hours a month to help them, help our facility run better.
Initially, when I was asked to be a part of the team, honestly, my first reaction was, this isn't something I want to do. But I have to say, once I did become a part of it and see the process in action and see some of the benefits of that work, it's definitely something I enjoy being a part of now.
It's more fun to come to work in the morning. I feel more connected with my staff members. I feel we're all on the same page. We're all working toward the same goal.
And if a practice measures its performance, measures the satisfaction of its staff, and finds that it isn't as good as it wants it to be, and it isn't having team meetings, that would be the place to start.
Give it a try in your office. Several months would be the minimal length of time, because it does take a certain amount of work first. It's a change, and change is always difficult for all of us. Make sure that all the bases are...
Teams have been shown to be absolutely critical components of effective, proven quality improvement programs. So there's no question that it's not just the politically correct thing to do. It is also the evidence-based thing to do.
The people who are doing the work actually take responsibility for the work and for the new program that they are implementing. So instead of having senior management come along and make unilateral decisions, we come together and work as a team, and ultimately we move together in the same direction.
We can't change the whole healthcare system in this country, but we can actually change our offices so that our day-to-day existence is more pleasurable and our patients get better care and our staff are happier. So why not do it?